Hello. So good morning. I'm Guldemond. I'm dealing with transformation of healthcare systems and improvement of healthcare on different continents: China, Russia, Brazil, and Europe. So I want to tell you something about the impact and challenges we have in healthcare, and the impact of the startup in innovation we potentially could have. So hopefully I can provide you some insights on the do's and don'ts in healthcare. So typically I'm working at a policy level onto the work floor, so at the interface, working for governments, the policy, the European Commission, but as well as healthcare improvement on the work floor, like countries like in Brazil, in favelas, and in normal communities and hospital organizations. So I want to share with you some experiences. So first of all, I want to provide you a sort of context on what we are dealing with in our society, and also the future of yourself and your children. Some words on the promises, or maybe false promises, of innovation and technology and the impact on healthcare. And lastly, the implication on startups and businesses, on what are typically the direction we could go for innovation. So first, let me explain. Of course, you know we are dealing with an aging society. And one way to express this is the age dependency index, which explains the proportion of retired people to the working people. And in many countries, this was in 2000s, this was about 1 to 4. This will dramatically change. So in Europe, on average, is 1 to 2. But you see that even in countries like Asia, but the same applies also to Russia, to Brazil, to Turkey, this will dramatically reduce, and for example, in China to almost, or even less, to 1 elderly person and 1 working person. So the impact is immense. So the productivity of a country is determined by this figure. So all these ideas that the fast-growing economies gonna save the growth, our welfare, isn't true because of aging and the relation to productivity. So this is one headache policymakers are dealing with. It's not so much in the news, but it has a huge impact on our society. The other thing is that aging doesn't come alone. With aging, we develop problems. So on the right-hand side, you see a diagram from The Lancet showing the number of people, the percentage of people with 1 or more chronic diseases for the Scottish population. And you can see that at the age of 65, about 80% of the people have 1 or more chronic conditions. And they are more dependent, because of that, on the healthcare system. So it's not only that we have impact in productivity of aging, but also we have an impact on the healthcare system. And think about that this 1 person, what we have in the future, according to this index, it has to provide the healthcare, it has to earn the money, has to educate the children, do the public administration, clean the streets, etc., etc. So our society, globally, we have huge challenges. And even countries like India, in the future, they are dealing with aging society. So we do have a bigger challenge here. Not only climate, not only energy, but this is also has a major impact on economies. So if you look into how current healthcare systems are dealing with this, they're becoming unstable. So these are items from the UK, and there's a nice documentary explaining the that the implosion of the NHS is imminent. It's a documentary you can find on the internet. You see that staff is overworked. And this is not only for the UK, but also in the Netherlands. And if there's a flu outbreak in winter, hospitals are overflowing with patients, ambulances has to wait outside. The same is here in Poland, in Germany, in China, etc. So we're really having great difficulties. So another image is the financial impact we have in healthcare. So what you here see is the relation between the income of a country, the income of an individual, and the rise of healthcare expenses in different countries. And this is normalized, so you can compare them. And so the healthcare expenses are growing much faster than the economy and the income of people. So slowly, healthcare consuming more and more budget from people, from societies, money which you cannot spend in infrastructure, in education, etc. So the impact is enormous what we have in healthcare. So we can't continue. So we need innovation, we need transformation in order to tackle this. And this is not only me is telling this. 2 weeks ago we were at an artificial intelligence conference in Sao Paulo together with MIT, and we had about 200 data scientists and programmers there. And this was a guy from MIT explaining, well, especially for the US, the healthcare business model there, it's totally broken. So you can see slowly, it's becoming unstable, not workable, and we have to transform. So what are the typical solutions we should look for fixing healthcare? So obviously, there's a lot of talk about digital innovation, AI, robotics in healthcare. And sure, the stories are wonderful. The industry is telling us, yeah, we're providing those solutions, much smarter diagnostics, robots will take over surgeries, etc. And invest in us. We bring the solutions if you bring us the money. Well, is that the case? Also, if you look into the evidence, I don't know. So what we see is that innovation is not delivering the promise it tells. Not only in the big tech, in the pharma, in the medtech, in health, IT, but also in startups. What we see is largely there are false promises. So they promise a lot, and they're raising a lot of capital in investments, but they're not delivering better healthcare and healthcare for the people here in Gdańsk, in the communities for elderly people. No, that is not happening with these type of technologies. So what you see in startup communities all around the world, also in Silicon Valley, it's largely based on investments, on subsidies. A lot of these innovations or solutions do not deliver value to patients, but they're delivering value to shareholders, to investors, because there's always a bigger fool who's going to invest next. But eventually, is the solution brought to the market? We don't see this in a huge amount. So also, if you're looking closely on the impact on technology on healthcare in general, and this is a study we done in the Netherlands, and you see the purple part is the current spending level, which is 80 billion per annum, which is a huge amount, but everyone can have the best healthcare there is in the Netherlands. But also we are dealing with unsustainability. So we have a healthcare rise of expensive, which will be doubled in 2040, which is totally unsustainable. About 1/3 is explained by demography, by chronic conditions, by the health status of people. But if you look to the majority, 2/3 of the healthcare expensive is explained by the rise of cost for medication, personalized medicine, and technology. All this fancy technology the industry is telling us we have to buy to improve healthcare. So the costs are sharply rising, and what we see, the impact on health of population, it doesn't do so much. So we're spending more and more money, you as well, in innovations and solutions which doesn't bring the value to society and which will eventually corrupt society. So we have to think differently on how we bring value to people and what's their important. So probably the solutions are not so much in these high-tech solutions like robotics or smarter diagnostics, but it should be focused on increasing efficiency of healthcare, doing more, better quality at a lower cost, less resources. We can't afford to invest in more resources. We don't have the people, we don't have the number, I show you the figures, and we don't have the money either. So we have to do more with less. That's the challenge we have in our systems. So here you see a sort of breakdown of healthcare expenses. And you see that only about 2 to 4%, more or less, these are all the figures, but still, about 5% globally in each country spent on technology for healthcare. About 10 to 15% for pharmaceuticals, and the majority of the money is spent on operational costs. So the promise of technology or innovation is that if we could bring technologies which could reduce the operational cost, then we have good investment. But things like artificial intelligence for better diagnosis, it sounds really wonderful, better diagnosis. We do intuitively related to better health outcomes, but it is not true. These technologies will drag people more into the healthcare system. So typically what the Mayo clinics and the Cleveland clinics are doing, they're doing these diagnoses, doing additional diagnosis, etc. So it's a money creator for the hospital. So usually there are a lot of technologies will increase only the operation, the fee for service, the income of hospital organizations. So therefore, it's important that we look for technologies we can increase efficiency and produce better outcomes. So healthcare is full of paradoxes. What in other sectors work for, like, for example, a better screening on the things you're doing, because then the process will be more efficient. In healthcare, for example, with diagnostics doesn't work. Genomics, the prediction models for genomics are really poor. So the only risk we have with more genetic profiling, etc., is that we're having more diagnosis, more treatments, and more side effects because of the treatments, and not necessarily better outcomes. And this is not so very prominent in the debate, but this is the reality, as I showed you in this graph. So what we can do, we should work on technologies which improves the general health status of people, can work on prevention. So if we can improve healthy life years of people, which you can see here in this graph, the black line is a sort of average health status over time, over lifetime of an average citizen. So if we could reduce the complications and improve health and reduce healthcare consumption, we already have solved a partly of this healthcare challenge. And technology can help. So increasingly we see solutions which contribute when you are ill, the lower arrow, Sorry, when you're healthy, to stay healthy. A better diet, more exercise, less stress, better health literacy. So these are potentially the solution which could bring prevention, more health years, and more healthcare, less healthcare consumptions. We increasingly, the second bar, technologies to better manage your disease if you're having a disease. So in diabetes, in cardiovascular diseases, and this also where we should capitalize on and further improve. And a lot of these solutions are behavioral related. They are not so much about smarter pills or pharmaceuticals or better surgeries. No, they are often related to healthy lifestyles. These are really the important things to extend healthy life years. Then we have a category which is more focused on a smarter environment where people can live more independently, stay longer at a home, feeling more social connected to others. And last but not least, of course, we have hospital technologies which might contribute to a longer and healthier life. So a lot of these solutions and the solutions you create are probably more potentially have an impact when they are focusing on efficiency, on better collaboration between these stakeholders in the healthcare system, but as well as a better collaboration and caring for each other in informal networks. So these are the solutions from which we know, also from research, which really contribute to better health and eventually will provide a better sustainable business for industry. So the experience from healthcare professionals with startups is, yes, we are quite conservative because we are very focused on evidence and that things should work. So it's currently not so much efficient, this system, on how we evaluate evidence and prove that it really contributes, but we should think together on how to improve this process and what is actually, how can we show the added value of our solutions. Related to this, a new directive in Europe will come in place, which might help you with getting access to markets. And I think it's also good to keep an eye on what's there important and that you hook up with stakeholders who can help you in this process. What we also experience is that whole lean and approach which we often have with startups. They are very opportunistic. So usually we invest our time in some nice solutions, but then the startup or the people are gone. So our time as professionals to contribute to the development is often not so well invested. So this opportunistic behavior of startups does create suspicion and reluctance and further engage in this process. So also there we should think differently, also from accelerator programs, from strategies, on how can we create this a sort of beneficial collaboration from both sides. And trust is also important. So about selling ideas, I think related to the previous point, it's so much focus currently on getting the investments in and not so much on the solutions that we might also think differently. How can we change this very opportunistic investment-driven developments into a more sustainable and responsible development of solutions? And obviously this requires not only action and an attitude from startups, but also a collaboration with regions like here in Gdansk, with the different stakeholders, where you create this environment, where you can experiment and can look a little bit further on the longer term on how to build a sustainable innovation system. So I hope I provide you some insights. Obviously, I'm more at a policy level. But the things I identified in this process over the last 20 years, I think there's a huge potential in this innovation area. But yeah, surely we need a good direction, and we have to go together, we have to fly together in order to make it work. Thank you very much.
Ladies and gentlemen, hands together for Dr. Nick Guldemond.